Hello, my name is Wendy Love Edge, and I'd like to welcome you to the Bulldozer Health Show. In this episode, I'll be interviewing Dr. Uma. Dr. Uma is a family medicine physician and an occupational and environmental medicine physician. She is also a cannabis therapeutics specialist. Welcome to the show, Dr. Uma.
Thank you so much, Wendy. It's a pleasure to be here tonight.
I'm so glad to have you here. So, Dr. Uma, let's talk a little bit about the opiate epidemic in this country. What are your thoughts about it?
It's really very sad to say that it's impacting everybody in some way, shape, or form. We know of somebody that's been impacted, or family members know of somebody else that has been impacted in the community. And it is an epidemic that has been created by our society and by our healthcare system.
Created by the healthcare system. Let's talk about that a little bit more. So, I can't remember when exactly physicians started prescribing things like morphine and Percocet and Vicodin.
Well, those medicines have been around a long time, but it was about in the late 90s when pain became an issue, and we wanted to address it.
Right.
So we called it the vital signs that we check on people. Pain became another vital sign. And if you go to most hospitals or doctors' offices, they'll ask you, what's your pain scale, 0 to 10? Is always the most common question. So in order to address this, we started to address this by giving people medications. And it usually started out with the over-the-counter medication. If you've got a headache or pain, from your Advils to your ibuprofens, to either your Tylenols or whatever you're able to get over the counter.
Right, and those pills have impact as well on the body.
Absolutely.
We're talking about the stronger, the next level. But what happens when someone takes something like Tylenol or ibuprofen over the long term?
Excellent question. So one of the basic things that I always want patients to understand is everything that we consume, for the most part, it's either metabolized by one of two organs. It's either metabolized by the kidney or it's metabolized by the liver. So in the case of Tylenol, it's metabolized by the liver. In the case of Advil, it's metabolized by the kidneys. So these all have long-term effects. And if you see, one of the most common effects that we see is that people end up on renal dialysis, right? Which is long-term effect of using these non-steroidals. And they either classified into two categories. We call it non-steroidals or analgesics. So analgesics are things like Tylenol. And Tylenol, being that it's metabolized by the liver, people end up with needing a liver transplant down the road. So these are pretty much the two organ systems that are impacted. So I always say, everything you put in your mouth, you hope you either pee it out or you poop it out. Eventually, right?
It has to come out somewhere.
Right, or most people are full of it,
right? Right. So that's, kind of, some people might think, well, that's an extreme case. I'm just taking a couple of Tylenol every day because I have this pain. Is it really extreme, or is it something that could happen with anyone over long-term use?
It's long-term use, People don't realize the small effects, and everybody's different, Everybody's kidney system is not the same. Everybody's liver system is not the same. And we have to understand this. And I'm not saying that pharmaceuticals don't have a role. What I believe is that we need to use the least amount. And our society, we feel like if a little is good, a lot must be better, right? When we've got commercials now where somebody's on an opioid and they have to take a pill because they can't poop. I mean, what is that about? And this is our society that we're facing. And
everything you put in your body has an effect, right?
Absolutely, positive or negative. And again, it's not just one thing. That's what we want people to understand. There's a balance. And everybody's balance is different. And it varies from day to day.
Right, that's true. Our body's always changing, right, and evolving, depending on what we ingest for food or water, soft drinks. There's so many different things, and they're all really related, I think. So we're talking about the first line, Tylenol, ibuprofen, and Advil. But then when those aren't working, it seems like what happened was physicians started going to the next level, right?
The whole evolution also began with hospitals wanting to give out medications to take care of our patients and to control their pain. But again, addiction, we talk about an opioid epidemic and addiction. There are different issues that they are kind of go hand in hand.
Right.
Addiction is an illness. So people can get addicted to multiple things, not just opioids. But in the case of opioids, most patients got this through a prescription.
Right.
50%, I think, are the numbers that we've learned that most of the opioid overdoses came from prescriptions that were given by doctors. And in this country, in the United States of America, we are 5% of the world's population consuming 80% of our pain. What is it that we suffer pain differently in this country than other countries?
Well, if like you said earlier, if physicians or other health professionals are told that it's a vital sign, right, then it's something they have to treat. And for allopathic physicians in this country, frequently it's with pharmaceutical drugs or surgery, right? Those are kind of the options.
We pretty much, when we've forgotten about the patient getting involved
Right.
in their care.
Right.
Patients are constantly told, well, here's your numbers, right? If you've got a blood pressure, here's a blood pressure pill, right? If you've got diabetes, here's a diabetic pill. If your cholesterol numbers are off. So when I practiced family medicine, I used to call it the party pack of five. The average patient was on a blood pressure medication, something for diabetes, something for cholesterol. And of course, they had to take something for reflux because of the side effects. And then the happy pill or the sad pill, something for anxiety or depression. So we've got people that have the side effects from taking medications, and they're also in real pain, either physical or emotional pain.
Right.
And we're treating it with just pharmaceuticals.
Right. So as a result of that, we have this rise, like you said, 80% of the world use of these drugs.
By the United States.
Right. And the effect of that?
The effect of it is, to me, criminal. Literally criminal, because these people are now stealing, harming other people because they have become addicted to this, that they started out. And let me tell you, in my practice, it's not like somebody decides that they're going to become an addict. They start out by something that they took for an ankle sprain or something that they took for sleep, that just for something that they needed a little bit of. And then they build up a tolerance. So no longer does that 5 milligram work. The 5 milligram becomes 10 milligrams. And guess what? They have access to it, right? So it's given to them.
Right, it's prescribed.
Yes, it's prescribed by your doctor. Your healthcare provider told you to go get this. And guess what? It is covered by your insurance company.
Right.
And you have a choice of multiple pharmaceuticals places to go to. You can go to any one of your pharmacy drug locations to get it. So it's not like you can't access it.
Right.
So it's given to you. It's so that it's all good, right? Because your doctor gave it to you.
Right.
And it's legal.
Right.
So we have built up a society, and now we're telling them, no, you can't have this.
Right.
And these people are now left on the streets, literally. When you have patients that were on medications, i.e. their opioids and their benzos for years, and all of a sudden, their doctor said, I got to cut you off, literally, or we got to taper you off. And these patients don't know what to do. And what happens? The next available thing is heroin.
Right.
And it's cheap and it's available.
Right. And it's so maddening and very sad all at the same time.
Very sad.
All at the same time. And so the system, in a legal way, is creating criminals in the end, really.
Share and live, puff, puff, give. It grows from the earth. helps the blind. Rock stitches to rhyme on time. Queen of Kaya, sweet kind live, grow to the sky. Puff, puff, give, puff, puff, give, puff, puff, give. Share and live, puff, puff, give, puff, puff, give, puff, puff, give. Share and live, puff, puff, give.
Pass, don't cheap on the left hand side. I say pass, don't cheap on the right hand side. I say lift your chalice if you're feeling high. We know why we puff like praise Jah Rastafari. Smoking Buddha makes me feel irie. I know why I feel free. Yes, I'm token sensei. So come on, puff up give if you know what I mean. So pass it around, baby, cause it's obscene. Don't hug the green.
Puff, puff, give, puff, puff, give.
Come on.
Share and live, puff, puff, give, puff, puff, give, puff, puff, give.
Come on.
Share and live, puff, puff, give. Good into brownie rice, crispy treat. Grooving, dancing in bare feet. Love and sunshine, free to live. Thank you, God, you got. Puff, puff, give, puff, puff, give, puff, puff, give.
Come on.
Share and live, puff, puff, give, puff, puff, give, puff, puff, give.
Come on.
Share and live, puff, puff, give, puff, puff, give, puff, puff, give.
Come on.
Share and live, puff, puff, give, puff, puff, give, puff, puff, give.
Come on.
Share and live, got puff, puff, give.
What are the solutions?
Great segue. You know, everybody has to get involved in this. And I practice what I call total healthcare THC.
THC, I love
Yes,
that.
yes, and you do need the THC. So as a cannabis therapeutic specialist, I want facts, and this is what I practice. And we use 3 words in my practice. We say educate, embrace, and empower. So all of my patients learn about the endocannabinoid system. And
Now, did you learn about that in medical school?
I am so sadly to report, no, I did not. I did not. And as you said, I have all these different trainings.
You have a lot of training.
Yes.
Yes.
Yes, I have been around the block in many ways of education,
Mhm.
and never had I learned about the endocannabinoid system, Wendy. And even now, only about 15% of the medical schools even teach it.
So what is the endocannabinoid system?
Thank you so much. It's my favorite system. I explain it in one word: life. It's a pretty big word.
It is.
And I say homeostasis, balance. So the endocannabinoid system that I've learned about has actually evolved over 600 million years from the sea squirt to what we have in humans. And I love the words that Dr. Damasio explains the endocannabinoid system. He says that the endocannabinoid system is meant for us to relax, eat, sleep, forget, and protect. That's my mantra. So let's look at those 5 words. So I said to you life, and I said to you homeostasis, balance. So when I look at these 5 words, too much or too little, that means you're not in balance. And it can happen at different times. So let's take the word relax. If somebody's muscle was in a constant spasm, or if it was flaccid, it didn't move, imbalance. If somebody ate too much or not enough. What if somebody slept too much, depression? What if they didn't sleep enough, like an insomnia?
Right.
Forgetting. People forget. Alzheimer's, dementia.
Mm-hmm.
What if you didn't forget enough? Like people that suffer from PTS.
Mm-hmm.
Right.
PTSD, right? I can
PTSD.
relate to that.
I can relate to that too.
Unfortunately. Mhm.
Unfortunately or fortunately, I can relate to it. And I say, we're not disorders. PTS is a real event. So when we talk about being able to forget, if somebody remembered that event over and over,
Mm-hmm.
you can't function. I always teasingly say, if a woman remembered childbirth,
Right. There'd be no more children, right?
Right, we wouldn't be having sex anymore, right? Right. There's an appropriateness of forgetting too much or not.
Right.
Protection.
Right.
Overprotection or underprotection. So let's look at that. Autoimmune illnesses. We're facing so many rheumatoid arthritis, people suffering from Lyme's disease and its complications. What if you can't protect enough? What if you've gone through chemotherapy? What if you've had radiation? Or what if you're diabetic? All of these people are now immunocompromised. So let's go through those 5 words again. Relax, eat, sleep, forget, and protect. This is life.
Right.
And so what we've learned is that this endocannabinoid system, let's take that word apart. Endo means within, cannabinoid system. So to explain it, when we talk about cannabinoids, we talk about 3 types of cannabinoids. We talk about endocannabinoids, which are made within our body, phytocannabinoids, which are plant-driven, and synthetic, which are made in the laboratory. All 3 of these work with receptors. And we found out about these receptors after many years. So Dr. Raphael Meshulam in Israel first started working with cannabis, and in 1964 identified THC, the psychoactive component in cannabis, as the psychoactive component, the cannabinoid, and CBD as a non-psychoactive component, as the spectrum. But we now know cannabis, canna means stalk or fiber, and bis means a plant with 2 sexes, has over 400 different chemicals, over 100 different cannabinoids, THC just being one of them and CBD being another. But there's so many. And these work with the receptors. And what we identified is CB1, cannabinoid receptor 1, which was primarily in our brain, CB2, which is primarily in our immune system. But what we found is that it's everywhere. That's why it works for so many different ailments.
It's like a miracle, really.
It is. And so that's what's fascinating, that we found that this plant was outside and yet there was receptors. It wasn't until 1992 that we identified that our body made its own endocannabinoids. And guess what? It mimicked THC. So the first endocannabinoid that was identified was called anandamide. Ananda means joy, bliss. And it mimics just like what's found in breast milk, anandamide. And cannabis, the cannabinoids, are able to work with the receptors, THC in particular. That's why this plant works so beautifully with our system and is able to give us this balance.
It's like it was made for us.
Thank you. It was. And sadly to say, most doctors don't know a couple of facts. Let's go through some facts. So first, number 1, nobody has ever overdosed on cannabis. And if somebody tried, you'd have to smoke a joint the size of a telephone pole in 15 minutes. It ain't happening. Okay? I'd like to take part in that study. Right? So no deaths. And we'll go into a little more detail. But the U.S. government has a patent for this.
Right.
And they've had a patent number 6630, number 507. And they've had this patent since October 7th, 2003. And guess what they say? Cannabinoids, all of them, as an antioxidant and neuroprotectant. Fact number 3, it was prescribed by doctors and in the pharmacopoeia in the United States. And it was listed, prescribed. Today, I don't get to prescribe it. I have to write a recommendation for it. And I truly believe cannabis is not for everybody yet. It should be a first-line option, not the last resort. Absolutely.
Right.
And I've been saying this for years. Cannabis is not an entrance drug. It's an exit drug from pharmaceuticals and narcotics. And I'm seeing that in my practice.
Hello, my name is Sage Amdo from Sage Advice LLC, and cannabis is my exit drug. I'm a medical cannabis patient in the state of Washington using cannabis to treat my condition of glaucoma.
Hello, I'm Dan from Connecticut. Cannabis was my exit drug. Now it's my medicine.
I'm Debbie. I'm in Oregon. Cannabis was my exit drug. Now it's my medication. It's replaced 12 prescription medications and multiple over-the-counters and supplements.
My name is Mark Prime, and I'm from Rogers, Arkansas, and cannabis was my exit drug. And now cannabis is my medicine.
My name is Teddy. I'm from Albuquerque, New Mexico, and cannabis is my exit drug. From Xanax, Seroquel, lithium, methadone, to name a few. Cannabis is my only medicine now.
My name is Christy. I live in Oregon. Yeah, cannabis is my medicine. I went from being on hospice and dying to losing over 100 pounds and getting off of 56 drugs. And I am free of opioids. Cannabis is keeping me alive and restoring my health.
Hi, my name is Amy Mellon. I am a medical cannabis patient from Oregon, just moved to Maryland. Cannabis is my medicine that I use every single day. I treat CRPS, complex regional pain syndrome, neuropathy, ADD, PTSD, fibromyalgia, facial, shoulder, eye tic, the list goes on. I believe it's an exit drug. It got me off my opiates, my other pharmaceuticals, and helped me drop weight. Cannabis gave me life.
The patent, it's very interesting. People don't take out a patent. The government doesn't take out a patent on something that isn't valuable. Would you say that's true?
That brings up a very important point, because right now cannabis is in Schedule 1.
Right.
Okay, and it's there along with heroin, LSD, and ecstasy. Okay? What that means is that there's no medical use in the United States, that there's no medical research in the United States, and a potential for abuse. And meanwhile, the U.S. government has a patent for it.
Right.
Let's ask some questions.
Mm-hmm. Something doesn't add up. Right?
It's criminal. It's criminal. It's sadly criminal. And what's really sad to say is that, again, it was cannabis. And they changed the name to marijuana. And that's what they created, a marijuana stamp tax in 1937. Mm-hmm. And then here it is, 2017. And 80 years later, it's still, I feel, in that same mentality.
Right. 80 years of prohibition. We're still here. There's been a lot of progress recently, but still, you know, I'm a cannabis patient. When I am in Massachusetts, I can legally use my medicine that works for me. When I leave the state, when I cross state lines, I can't bring it with me, even into another legal state. You know, it's very difficult for patients, and yet very easy to go and still pick up these other drugs, opiates, or the over-the-counter drugs that clearly, as you pointed out, affect the kidneys and the liver.
And there's debts related to this. And you bring up a very important point. If you're diabetic, if you go out of the country, your diabetes just doesn't disappear because you're out of the country. So why should your zip code, this is my question, why should your zip code be your factor in you accessing your medicine?
Right, I agree.
And why is it the lawmakers are telling me how to practice medicine?
Right.
Why is it that we have a list of conditions that change from state lines to state lines?
Right, it doesn't make sense, except that many things come down to greed.
Absolutely.
And that's where we are, and discrimination, you know.
It's very, very sad. Again, I keep the word sadness, I've mentioned it several times, because that's the only way I can say why. Mm-hmm. I asked this question, why? Here we are in 2017 that you can't talk to your healthcare providers about this, and healthcare providers can't talk to our patients. And the reason is because we have it in Schedule 1.
Right.
So it is still federally illegal. Right. It needs to be deschedulized, Wendy. It has to be deschedulized. And that's part of what I'm fighting for, is that we need the education. Mm-hmm. And we use 3 words in my practice. We say educate, embrace, and empower.
Bulldozer Health Incorporated is a 501c3 nonprofit organization and healthcare reform initiative. You can find us at bulldozerhealth.org. Take back your health, America.